All right. I want to thank Dr. Axel Martinez for coming in today. Dr. Axel Martinez works with me at ATL Pain Institute. He is our clinic director. He's completing his master's in neuroscience from Parker, correct, Doc?
Yes,
And
sir.
also in October, you'll sit for your exam for your Diplomat of Neurology through the American Neurology Association. Is that correct?
Chiropractic neurology, yeah.
Yes, the CARIG program. So,
Mhm.
all right. Well, thanks for coming on. We're talking about we've been using SoftWave in our clinic for the last 6 years, and it's just been really phenomenal. We're really tapping into working with patients who haven't gotten better at any other place. And a lot of the ones we've seen is spinal cord injury. We have worked together on some patients who are discharged from Shepherd Spine Center. We go in that into our advanced orthopedic and neurology protocols. But today we're going to really talk about whiplash and what's happening in that field. And I'm going to pull up my class I did. Can you see that, Doc?
Yes, sir.
All right. So I'm gonna start this here, right? We've been using the SoftWave, which is one of the most versatile medical devices that you've never heard of. But until now, you're going to start hearing more about. This is a genuine lithotripsy. It's the same technology they've used for 40 years to break up kidney stones, biliary stones, and salivary stones. And it delivers low intensity, unfocused, supersonic sound waves that can penetrate the depth of a soup can into the body and really stimulates the body's own natural innate healing ability in minutes. So today we're specifically talking about car accidents and what happens to the structural side of the body, right? The physiological process and how ligaments and the joints can be damaged. In our next episode, Dr. Martinez will be talking about what happens to the central nervous system. So I always say to my patients, I'm fine. You're fine. You're fine until we check your spine, right? Because the true effects of car accidents might not show up for 2 days to 2 weeks to 2 months after it. So this is a test that we want patients to come in and really see. So 27 years ago, when I was just starting in practice, one of the internationally renowned journals, the Spine Journal, came out and in a supplemental issue, they talked about how there was a pandemic and the fact that the world's trauma centers in emergency rooms they were losing the battle when assessing, diagnosing, and treating whiplash injuries, acceleration, deceleration injuries to the cervical spine and neck. In fact, it documented that 2 years after a motor vehicle, 20% of injured were still in a moderate to severe pain level. And they also said they needed a better way to diagnose soft tissue injuries as well as a more efficient form of treatment. This device checks both those boxes. And this is just one of the little excerpts. It was a round table. And they said, can early treatment prevent acute whiplash from becoming a chronic issue, meaning long-term, more than 30 days? And they talked about how common types of neck injuries, typically caused by rear impact, traffic crashes. Studies consistently show that neck pain and other symptoms of acute whiplash injuries clear up within a few months in about half the patients. The other half have continued pain and disability 1 to 2 years later, with 20% of those. And they talked about early management was critical in the long-term approach of how to treat these patients. Many different treatments were looked at: immobilization, acupuncture, electromagnetic, ultrasound, even invasive facet injections. Okay, and we'll talk about it. But none of these treatments over the last 25 years have actually been shown to reduce any of these major issues. So we're going to dive into And I'm going to show you, obviously you can see what happens, but in the other studies, it says 33% of whiplash injuries go undetected at ERs. That's terrible. Delayed diagnosis has been attributed to various reasons why people are just not getting better. And you can see what happens to the X-ray or the cervical spine, right? That's an extension and then flexion. So that's what happens. First, it's really a process that we're going to look at and break down in a video. But motor vehicle accident injuries go undetected. Misread radiographs 35% of the time. Absence of symptoms after the first visit is a big one, but also they're missing the diagnosis on a facet flexion extension injury. These are the little joints in between the cervical vertebrae, and they all have these ligaments that are like rubber bands that hold all those bones together. There's several ligaments that we'll look at in the next few minutes. So this is what, on the left, this is what a normal cervical spine should look like, with all the weight, 2/3 of the weight are on these pillars. They're called lamina, and they hold the weight of the head back there. And then you see the spinal lamina line. Here's the spinous process, the front of the vertebral bodies. This is an example of someone who has an abnormal cervical spine, typically resulting in after a spinal injury or a whiplash type injury. This is a mechanical issue, right? So if you have your pinky and you push it back, that's a mechanical stress on these joints. And what happens is if you dislocate that and it holds like that, that's a problem, right? But you would go to the doctor because you see it every day, but people don't see this in their cervical spine. You're going to talk about the torsion and tension that happens, but this is C5, C6 is typically the main area that's damaged. That's the stress point. And you're going to talk, I'm talking about the bone and the mechanical issues. You're going to talk about the central nervous system at our next one. And again, this is what happens when you look at the intersegmentals. There's flexion. This is bone, disc, bone. This disc can be damaged, but also these facets, these pillars back here, are little capsular joints that have synovial fluid. They're actual joints. So I'm going to show you on the left is looking at a pretty extensive MRI. And you can see the brain, brainstem, and spinal cord. They're named differently, but they're all one thing, right, Doc?
Yes, they're very connected.
They are our central nervous system. MRIs look at soft tissue, and the X-ray looks at bones. And this is side-by-side view. So there's C1. Your brain stem comes down right into these two. What's that called? The foramen magnum, correct?
Yes.
And that's the thickest part of your spinal cord right there. And it's kind of where the brain and spinal cord transition. When they hang someone, this is where you break that bone between C1 and C2. Is that correct? What's that called? The osidontum?
Mm-hmm. Hyman fractures also.
Yep. But you can see all that gestures. This is, but I want you to understand that we're more complex than just a two-dimensional X-ray or MRI. And what they're saying is during that rear end injury, your neck actually folds into an S curve, which damages where these small capsular joints are in the back of the pillars of the joint. So I'm going to show you what that looks like. That's intersegmentally. That's where they actually do facet blocks. That is invasive. We want to explore and exhaust every alternative condition before we invade or puncture the skin. This is Matt Powell, one of the leading personal injury attorneys, and he's really an expert on whiplash injuries. Here we go.
Acceleration is produced when a force acts on a mass, and the greater the mass of the object being accelerated, the greater amount of force it will take to move it. With these two general explanations of the laws of physics, let me show you what happens in a simple rear-end car crash. Before the moment of impact, the person inside the car and the car itself are resting without motion. As soon as the car is hit from behind, the mass and energy from the moving car begins to transfer energy into the stopped car. What most people don't understand is that the body of the person sitting in the stopped car will not move immediately with or as quickly as the car they're sitting in. But instead, there is a lag in time before their body starts to move. In this graph, we have time going along the bottom and G-forces are on the left. The steel frame of the car being hit will begin to accelerate forward from the impact. However, the person in the car will resist moving due to Newton's law of inertia. What will happen is
All right, so we're going to see what happens
picture
here.
how the driver's hand is off the steering wheel. Then the pressure from the seat shoots the torso of the human body forward like a diving board propels a diver. The torso moves first, and because your head is somewhat like a bowling ball supported only by your neck, your head will remain motionless for a few more milliseconds. So the car moves first, then your torso moves out from underneath your head. This forces your head to suddenly have to accelerate to catch up with the car and your torso. This very sudden acceleration of your head causes 2 points of stress in your neck. The first stress point is at the cervical vertebrae C5 and C6, and the other stress point is between the cervical vertebrae C1 and C2.
We just talked about that.
These two areas of our neck usually get the most damaging forces, which oftentimes tears or permanently stretches the ligaments that hold our vertebrae in their proper place.
See what I mean? So this is a close-up view of that facet capsule. And these are like little rubber bands that hold those pillars in place. And you can see where after damage, that synovial fluid can be compromised, and after mechanical stress to that joint, you can have abnormal wear and tear, which turns into almost like facet arthrosis or an arthritis to that little joint that can become painful. Just like a rubber band has like an endpoint, that's what happened with these ligaments. You can obviously have different levels, but these are the lines that we look at on X-ray to see where the normal alignment of vertebrae. But they also are very thick ligaments that hold all those bones together. And you can see them here. There's an anterior longitudinal ligament to the front of the vertebrae. There's a posterior longitudinal ligament. There's small little ligamenta flavum that holds those little facets together. There's interspinous ligaments, and then the posterior aspect of the supraspinal ligaments. But this can be damaged. There's 4 different grades, right? Grade 1 is 25% tear. Grade 2 is 50%. Grade 3 is 75%. That's what we're looking at there, almost a complete tear. But there's different layers. So how deep it goes into depends. But this is all connective tissue, which we're going to get to in a second. Right? So again, we're taking some close-up looks. You can see how these ligaments bend, and when they're not functioning, how you can get abnormal wear and tear, again, on those facets. So, you know, fast forward to 2017, 6 years to the month that I was introduced to soft wave tissue regeneration technology. I had a hand surgery that went terribly wrong, and I basically was out of work for 3 years. I had to stop being a chiropractor, but I was left for 10 years with pain. And April of 2017, I got 3 treatments on my wrist over a 10-day period. I had 90% improvement, and it kind of flipped my whole paradoxical way of thinking on how healing happened. So the coolest thing about this technology, and you see it every day, Doc, is that when you run this over normal tissue, there's no pain. There's a diagnostic tool. That's why we have this in 15 professional sporting teams. But as soon as you run it over areas of poor circulation, inflammation, arthritis, or damaged connective tissue like a tear or even a fracture, you'll be like, there's a biofeedback component where the patient's like right there. And I remember as a kid reading this magazine, Mad Magazine, in the back, you could order these X-ray vision goggles. And this device reminds me of what it, like if we had X-ray visions. And we talk to the patient like, oh, we're going over the bicep tendon. Here's the transverse ligament, here's the deltoid tuberosity. So as we're mapping out a chief complaint, we're looking at that anatomy and assessing it. I love that part about it. But there's also a healing component, right? So once we find those bad areas, what do we do to the energy level, Doc?
We start going up.
We turn the energy level down to more of a healing mode. If it's deeper, we have to go higher energy, but we make it more accessible for the patient to tolerate these treatments.
Right.
Great. These are supersonic sound waves. These are everywhere in nature, right? There's the when a jet breaks the sound barrier, it's moving 765 miles an hour. What we're doing is literally harnessing the power of a lightning bolt and the clasp of thunder and putting it into that handle applicator. Because it's electrohydraulic, it means we have electroshock surrounded by water that magnifies these supersonic sound waves to 4.4 Mach. So 4.4 times the speed of sound. That gets us to 3,355 miles an hour. And that's fast. And we can penetrate the depth of a soup can. I want to be able to move this a little. Okay, I don't want to mess with it. But as you can see on the left is our fingerprint for the soft wave. And it has both a primary and a secondary supersonic sound wave. And as you can see, the high pressure goes above the x-axis, and then that's a positive force, and the negative one drops below the x-axis, and that's the negative tensile force. It's like when you're standing in the beach and the water hits you the first time on your legs, that's positive pressure. But when the water sucks back into the ocean, that's a negative tensile force. And that's where our researchers are saying most of our positive biological effects are happening. And this is a breakdown of all the different ones. I think our picture's in the way, so it's not great. But this shows the depth of our device, which is, basically can penetrate that deep into the body. And that's important because that's how far 12 centimeters is more than enough to get down to those interspinal and capsular ligaments. Would you agree, Doc?
Yes, that's true.
And not all shock waves are created equally. You see the one on the right, that's electromagnetic, and then the one on the left is a radial. And those are they're not creating supersonic sound waves. Their depth of penetration is the electromagnetic is like a Sharpie. So it's the circumference of that Sharpie and the depth. And then the radial device is more superficial. It's only the depth of 5 dimes into the human frame, okay? So that's important. This whole process is really, our device does not cause any trauma to the body. It's working on a cellular level, and we're showing you right here. I might have to escape that just so I can move us over here and then play this again, because this is important. So the first part is the cell on the top with the normal cell resting. And when the high pressure comes, it's actually compressing that cell membrane. And then you see the negative tensile force here that expands that cell by 10%. So the change is 12%. And what we believe is happening, it's true, it's actually happening, is this shedding off extracellular vesicles. It helps improve cell membrane permeability, helps improve the health of the cell. It sheds these microvesicles and extracellular vesicles that are stem cell and repair and helper cell attractants. So it actually resets the whole body's natural cascade of regenerative healing. These are many of the effects, therapeutic effects that happen. The pain relief, we see within 3 visits, the pain is cut by 50%. This is even for older injuries. This may be the billion-dollar ticket right here, this anti-inflammatory. We help downregulate inflammation, which I believe, and you're going to go into more, is really, you've gone into it in some of your classes already, inflammation is really the main culprit of where pain is coming from. So it also improves vascularity and blood circulation. It forms new bone tissue through osteogenesis, stimulates natural anabolic and growth factors within our body. We have a class 2 clearance for activation of connective tissue, which is skin, bone, cartilage, smooth muscle, striated muscles, and nerves. And again, within minutes, activates mesenchymal stem cells and migration and proliferation. Again, our name is Softwave Tissue Regeneration Technology. What makes us different is this parabolic reflector. So this is patented. We actually have 48 patents, but because of that parabolic, it helps get that high heat and sound waves deep into the body, producing a true shock wave. Okay. And this shows exactly what it looks like. This is one of the reasons, this is newer technology, but this whole cylinder is a positive biological zone. And that's why it's so important to look at this patented parabolic reflector. This is really cool. Anything in this blue zone is healing. Anything in that area. Isn't that cool? And I'm going to show you what it looks like when we work on a pig model too. So here's the depth of penetration. And we use the yellow unfocused. The blue is more focused. It just has a smaller, more narrow treatment zone. And this is one of my buddies, Cyril, PhD, who's this is showing our soft waves going into.
Right, so I actually model the sound fields as they propagate and distribute themselves through, in this case, the spinal cord. But it allows us to
see how deep that's getting. So again, 50% of the bone is absorbing those soft waves, 50% of it is reflecting off, but it's getting deep enough into those intervertebral foramen. That's what I want my doctors to understand. Plenty of research now, over 3,000 papers, 1,000 of them in the past 5 years, done in United States. We're working with Harvard, MIT, Dr. Tom Liu and his team out of University of California, San Francisco. They're just doing some phenomenal studies. And Dr. Tom Liu's team probably has 17 papers on activation of stem cells within minutes of treatment. So this is what we see, right? These are all basically wherever you place this device on the human body, we're seeing a positive biological effect. And that's awesome. That makes me excited. It's from improved mitochondrial function, increased angiogenesis, neovascularization. We had a whole class on left ventricular ejection fraction and what Dr. Johannes Holfeld, the cardiac surgeon out of Innsbruck, Austria, is doing, and 67 bypass surgeries, recruitment of the innate immune receptor, toll-like receptor 3, which is really key in modulation of healing and really how you affect inflammation. We see it in improved sexual men and women's health, improved range of motion. I always say it's like the WD-40 for internal joints, for tired and arthritic joints, decreases pain, improves the Austrian workers' comp system has, over the last 11 years, has estimated they saved 70 million euros using our technology in 13 of their trauma centers. It has wound healing. We actually, our doctors, our med doctors at our clinic actually get paid for wounds and diabetic ulcers. Improved exosome circulation, improved blood flow, decrease inflammation and swelling. And again, class 2 clearance of activation of connective tissue. What is connective tissue, Doc?
Fascia, ligaments, bone, periosteum. There's a big.
That's right. Oh, this is under electron microscope. This is the mitochondrial before, as you can see that. And then it's in an anaerobic state and it's only producing ADP, adenine diphosphate. Now look at after. This is 10 minutes after utilizing soft wave on the mitochondrial. Those are the powerhouse to the cell, but there are so much more. They're in every cell in your body, except your red blood cells. They make up, if you took them all out, they make up 10 to 15% of your body weight, and they are part of your immune system as well. So we are registered 510 clear device to help reduce pain and improve blood supply. We were also class 2 technology for treatment of acute second-degree burns, treatment of chronic diabetic foot ulcers, and activation of connective tissue. This is from the US, the FDA, and, oh, sorry, I don't know what I just did there. Can you still see it?
Yeah.
And, there we go. And the OrthoGold 100 is intended for the activation of connective tissue. This is why I'm so excited about this. What is connective tissue? Just like you said, it's the blood, it's the bone, it's the adipose tissue, it's the cartilage, it's the fabric of life, it's the matrix of everything, right? And you can see that under a microscope, what the different types of dense connective tissue, adipose tissue, areolar tissue, compact bone, and blood. So it's the cartilage between the shock absorber between those joints and bones. It is the blood, it's the plasma. It's all of this. It's the cartilage, the nervous system, the bones, the epithelial. I could keep going, right? In the elbow, it's the cartilage, the bone, the blood, the fibrous tissue, the subcutaneous fat pad underneath this. It's everything. Nervous tissue. So we can just keep digging down. It's the endothelial of the arteries that and capillaries. It's part of your spinal cord. It's the interlining of your stomach. I believe with our more is more protocol, with the new OrthoGold 350, you're going to see us working more on organs. And Tom Liu, he's got a patent for organ regeneration. That's even tendons. See that? Tendons. So you can see effectiveness and versatility, really healing from within. And this is a non-healing ulcer to the left that wasn't healing for months. And after 4 treatments, it over a 6-week period, it healed. He'd already had 2 of his outer digits amputated, and they were looking at a below the knee amputation. The one on the right is from our friend, Dr. John Mullins at Piedmont Hospital. It was a non-healing talus fracture for months. He did 4 treatments over a 3-week period, and this was taken 5 weeks later. So you see it on the right, healing that MRI. Okay. So again, this is the OrthoGold is a acoustic pressure treatment for chronic foot wounds and ulcers. It is a class 2 clearance for superficial burns, and it will be, it is, OG 100 is the standard of care for burns. And that's where we're looking at. You see all the different applications. We know it works in orthopedics, physiotherapy, rehabilitation, any type of itis, tendinopathies, right? Any neurological ones, that's your specialty. But anything with like arthritis, inflammation, it's working. And we have over 48 patents. And this one that I just popped up there, that's for neural elongation and promotion of nerve regeneration and nerve growth. How many companies have that? Not many. Not many, my friend. We're trusted. We're in some of the top teaching hospitals and universities, as well as Cleveland Clinic, Mayo Clinic, 15 different professional sporting teams. It's effective. What's your average time you're in there with a patient doing the treatment, Doc?
5 to 7 minutes, probably.
That's clean, putting the gel on, the supersonic gel, doing the treatment for 4 to 5 minutes, cleaning them up.
Mm-hmm.
It's effective. It's proven. It's very user friendly. We know within minutes if these patients are even candidates. That's what I love, right? Because if you run it over their chief complaints and we can't find pain, they're not candidates. And this is one of my favorite patients. She would come down from Philadelphia. On the left is a cyanotic foot prior to SofWave, and on the right is a 3-minute treatment. That's on my YouTube page, Dr. Matt Duro, the actual treatment. So we're almost finished. Thank you, Doc. We went through a lot of material. This is a young lady who 3 years ago was involved in an accident. Seemed simple at the time, but ended up having 4 different spinal surgeries, and she had lost hope. I'm just going to play this now and listen. This is before and after a treatment.
Okay, Karen, we're about to start your first SofWave treatment. We looked at your x-rays after doing an examination, and you have quite a bit of pain in your neck and your lower back. Would you mind sharing what you feel like now and just kind of what you've gone through, and then we'll do a treatment and we'll do an after video to see how you feel.
Yes, my name is Karen. I'm here today to try the SofWave. I feel like I've tried just about everything. I'm on a lot of medication. I've had 4 surgeries on my back, and I've kind of lost hope in trying to find a solution to my pain. So I'm here today to try the SofWave.
Awesome. I'm looking forward to seeing what we can do to help you. You are an extreme case of neck and back pain, and we'll see what we do to help you out.
All right, so we are with Karen after her first SofWave treatment. How do you feel?
I feel great. Thank you so much. I've only had 1 treatment, and I've already felt significant results. My pain has decreased. I feel great, and I don't even feel myself because I've been in pain for so long.
How long has it been?
3 years of chronic pain.
Wow.
I've never had 1 day without pain, and right now, I think I went from an 8 to a 3.
In 1 session.
Yes.
And you walk with that cane, and you've
I don't
been.
have the cane.
I mean, it's amazing.
Smile.
That you've had such a great experience with just 1 visit, being such an extreme situation. We didn't even know how you would respond after just 1 session. We thought it might take a few sessions, but already from an 8 to a 3 is a substantial gain. We look forward to treating you further.
Thank you so much. Thank you.
You're welcome.
That's from Dr. Dan Jurgens and Dr. Allison Flores in San Diego, who've had the device for 14 months. And this is one of the best testimonials I've seen this year. Isn't it beautiful? I mean,
Yes.
the lady, you could see her transformation.
Her affect changed like
Yeah, she
dramatically.
doesn't need a cane anymore. And we'll get an update. She's doing great. But that's it, man. That's basically what I wanted to chat about. You know, this is really a productivity and profitability increasing system, but it's teaching the body how to heal from within again, especially in those intercapsular ligaments that I think is kind of been missed, as you see with the research over the last few years. So thank you so much, Doc, for taking time out of today. And I really appreciate everything you're doing with our clinics. And I can't wait to see how you piggyback with the internal and the central nervous system. Thank you, my friend.
Thank you.
All right. Bye-bye.